观众大家好，今天是11月23号，2020年11月23号，转眼一年快到了。我 BC 省从第一次新冠疫情新闻简报是在1月的21号、22号左右，应该是说很早，就是第一例是从中国广州过来的。这位先生呢，他是自己自述在中国大陆的时候，经常从广州出差到武汉，所以他我们 BC 省第一例应该是不是加拿大第一例，应该是1月30号左右吧。那时候我是去了他们在 BCCDC 地下室有一个很小的一个新闻简报室，比白宫的新闻简报室还要小，但是呢，新闻记者已经很重视了，所有的媒体几乎都参加了对，这是我们 BC 省第一例的同报，所以比较重视。好，那么我们的卫生厅长已经出现，今天的Bonnie来了多来了还把眼镜脱了一脱。
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer, and this is our COVID-19 briefing for British Columbia for Monday, November the 23rd. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. The schedule of briefings will be slightly different this week. We'll be briefing in person today, Monday.As well as Wednesday and Friday.
那么择期开刀的延期手术呢，也会给大家礼拜一和礼拜四都会汇报了。那么礼拜二、礼拜三都是书面的。
Around 3 o'clock. With that, I'm honored to introduce Dr. Bonnie.
那么现在请 Bonnie Henry.
Thank you very much and good afternoon. For today, we are reporting on the 3 periods from Friday to Saturday to Sunday, and Sunday to today. From Friday to Saturday, we had 713 new cases of COVID-19. Saturday to Sunday, an additional 626 new cases, and from Sunday to today, 594. For a total of 1,933 new cases of COVID-19 over the past weekend, including 11 of which were epidemiologically linked. That brings our total number of people with COVID-19 in British Columbia to 27,407. The new cases by health authority, 414 people were in the Vancouver Coastal Health Region. 1,304 people were in the Fraser Health Region. 48 people on Vancouver Island. 104 people in the Interior Health Region and 61 people in the Northern Health Region, and an additional 2 people who normally reside outside of Canada. We now have 7,360 active cases in British Columbia, of whom 277 are in hospital today, 59 of whom are in critical care or ICU. We have 10,200 people under active public health monitoring and 19,069 who have recovered from COVID-19. As we've moved into this phase of our pandemic, our hospitalizations and our transmission in long-term care has increased, and over this past weekend we've had 17 people who've died from COVID-19, bringing our total to 348 people. The majority of these people were seniors and elders in long-term care, and we send our condolences and our thoughts and prayers to the families, to the caregivers. We know how challenging it is.
其中我都会给大家说一下礼拜5到礼拜6是713，礼拜6到礼拜天是626，礼拜6到礼拜天到礼拜一是594。现在又有6个这个长期护理院和卫生诊疗所之类的爆发。
Renfrew Care Center and Lionsgate Hospital.
Lionsgate Hospital 大家已经听到了几次了。
at the Nanaimo Regional General Hospital and Evergreen Baptist Care Society. That leaves us with 60 active outbreaks in our healthcare system.
现在已经一共有60个其中54个是在长期护理院。 还有6个是急诊性诊疗所。厉害，17个死亡，这次死亡率很高啊。
And that is a very sobering thought for us, knowing how challenging
他说现在是太高了，这个数字啊，这个特别是在长期护理院的发生的情况太可怕了。
And that really speaks to where we are right now.
所以我现在要告诉大家，我们现在所处的环境情况是怎么样。
It is the most challenging of our time.
现在我们是最困难的时候。
And we are all feeling the strain.
我们现在都感觉到了这个病毒不会停止。我们有时候会感到很沮丧。但是病毒的步伐不会停止。
It spreads quickly.
它会传播很快。
For us to catch up.
所以这个而且使得我们很容易传染到。
Because I do think there is hope.
但是我认为我们始终有希望。我们一定要有希望，这个
to control this virus.
要有信心。
And not let it control us.
我们一定要有所有的资源，我们所有的工具、措施来。
That I have seen in people across this province.
我在全省都看到了很多人做的正确的事。
We all think about what can we do today to make
我说的挑战，我们也是知道，就是我们很多人还可以做到，但没有做到。我们希望大家能够立刻行动起来。接下来的2个礼拜，我们一定要急速的减少这个获得，能使得我们的上班的地方、我们的学校能够安全，能够正常运转，同时保证我们的医疗资源。这样的话呢，就是大家不要再社交了。减少社交活动，使得我们的医院、我们的学校能够正常运转，安全。
We have been learning. It's not the same as it was even a few weeks ago.
这个大家已经清楚了。同时呢，我们对这个病毒的了解也不是几个礼拜所知道这一点点，所以我们现在面临的这个复杂的天气情况，所以我们就是我们已经也如何应对，包括了我们也要注意如何更加注重这个医疗资源、医疗系统的正常运转。所以在过去几个礼拜里边，我们发布了一些新的卫生命令。这个新的卫生命令其实都是和我们之前都和这个菲沙卫生局和延安卫生局相似的这些命令。现在把这些命令扩大到全省了。这些命令其实是很清楚，大家也很清楚如何落实到位。
Unusual, we get asked a lot of questions, and people want to know what does this mean to me.
所以大家一定要清楚，我们现在所做的这些卫生命令对自己意味着什么。大家一定要意识到现在这个特殊的情况，现在特殊的环境，我们一定要采取新的卫生措施，限制的新的限制令。我也呼吁大家能够重视起来，能够重视这个我们现在所处的形势。我们已经看到了这个流行病在我们身边发生，希望大家减少社交的活动，特别是在室内的时候，特别要考虑风险。我们一定要考虑到我们自己家里边的安全，不要把这个风险带回家。所以我希望大家呼吁大家每天想的第一件事情、重要的事情就是安全包括这个希望大家能够就是重视现在所处的环境、所处的行动。那么在家里边我们一定要记住，就是跟知底的直系亲属待在一起。希望大家不要再走亲访友了。我们这个不需要再扩大了，把这个朋友亲戚都叫得来。这个不需要了，也不要也还有就是没有 couple 了，什么把孩子一起送到学校，或者是去接，或者是这个祖父祖母再去接孩子都不要了。那个还有就是在大家的后园里边没有家庭聚会的开 party 了，没有了。这个是整个全省都是这样了。
And that's why we've said if you live alone, you can, of course,
那么我也说过，如果你是一个人的话，当然你也可以得到很多人的支持帮助啊。这个不是说就是连这些资源都没有了。所以大家都要清楚啊，大家连接在一起不一定就是面对面这种社交了。我们有很多的方法使大家联系起来。所以你可以完全可以锻炼健身，可以和1-2个朋友一起骑自行车啊，在外面骑自行车等等，这些都是那个。然后呢，这个和家人的团聚啊，这个都包括身心健康都很重要。那么如果一定要做呢，希望大家在室外，能在室外就室外，能够保持距离必须保持距离。这样的话呢，使得我们的这个社区就会安全，大家呢也会可以组织在社区里边做一些体育锻炼的项目，当然都要在室外，都要保持距离。那么我同时呢也会对这个聚集，因为马上就要圣诞节了啊，有一个新的命令，包括婚礼啊如何限制室内的一些限制啊，包括在餐厅、在宾馆。包括在餐厅这个以及这个电影院等等。
Very great and well thought out.
我也知道，我这些命令使得很多有想法或者是有创意的这些活动啊、party 啊都会阻止或者延缓，那么也是没办法的。啊，都是该停的都停了，我们之前批准的现在都要停下来。我们现在所做的就是要这个使得潜在的风险给去掉啊，希望大家能够考虑到这个安全，不要为了将来还有这个计划聚会啊 party 都不要了啊，包括那些捐款的等等都是啊，我知道他们也提交了很多的卫生措施、卫生计划，我知道很多措施都是行之有效的，但是现在都停了啊，我们现在都停啊，所以暂停了，都暂停了。请大家记住，暂停了。
That does not include meetings such as city council meetings
但是呢，这个相互支援的开会啊、市政会的议厅啊、开会啊都不是说必须停了，没有停。我们只是希望能够停的都能够停，有些不能停的就也不停。
And if you must meet in person,
能够虚拟开会的就是虚拟开会了，不要在人和人之间的见面了。
In person, you must have COVID safety plans in place. It must be the
希望大家一定要有一个新冠安全措施的这个落实到位的计划。所以做任何事情之前，问问自己我们能不能必须要见面的，能不能可以网上见面的。能不能推迟的一定要问自己。现在马上要到12月份了，那么现在这个命令是到12月7号啊，我们现在在紧密的观察，看看我们现在这些卫生措施、卫生命令是不是使得曲线能够拉平，我们也会实时的给大家更新。那么他说，很多人也描述了这次全球流行病像一场漫长的马拉松，看不到尽头啊。这个比喻也好，美国人比喻是这个隧道啊。那么他说这个呢，可能是不是马拉松了，可能是3项铁人项目了。因为铁人3项，一个是游泳，一个是跑步，一个是骑自行车。那么现在我们是在骑自行车阶段。那么现在还在爬坡，很累，很吃力。现在这个坡很长很高，我们还不知道下一阶段是什么时候，什么时候能够结束。但是我们可能马上会，我们马上就要到顶点了。大家如果到了顶点往下冲的时候，大家会享受啊。我们现在还不知道终点站在哪里。我们下一步现在还看不见在哪里， 希望大家足够允许。那么只要疫苗一旦被批准，一旦面世的话，我们就会马上就是道路了这个转换期，那么就看到了这个终点站。那么这个节奏我们希望也是大家很清楚，我们要一步一步往前走。我们大家也很疲倦了，现在这样做。我们一定要记住，一定要措施落实到位。我们今天所关注的。只能是现在就是要阻缓这个病毒的传播，那个希望能够减少这个大家相互之间的联系。现在这个阶段就是在全球流行病的最严重的时候，所以我们只能减缓这个病毒的传播速度。我们一定要扪心自问，我们能够做什么来减缓这个病毒？能够使得我们的热心、我们的同情心用出来，能够使得那个病毒的传播能够把它拉缓。那么希望大家还是3个 be kind, be calm and be safe 那么卫生厅长在做一些总结，他肯定会说这个17个人在哪个卫生院、卫生局、这是17个在周末死亡死于新冠病毒。整个从礼拜五、礼拜六、礼拜天3天他说了这个5个是昨天到今天13个在飞沙其他都是在沿岸。我也是给每一个省民说一下我们也是诚挚的哀悼给这些失去亲人的家庭我知道你们所面临的时间特别困难
due to COVID-19
特别是又面对着新冠疫情我们每一个案例每一个死亡对我们来讲都很重要。我们已经失去了17个珍贵的生命，我们一定在想着他们我们也知道现在困难的很。那么同时呢，我们的公卫系统工作人员也付出了额外的努力。那么现在已经有1万多个10200个在这个监护下自我隔离。那么他们也是我们的公卫系统工作人员，也是协调努力一起大家一起共同面对。所以我也是希望大家礼拜4的话我们也在电话里边回答了很多人的问题很多人也提供了建设性的意见和建议。那么我们认为这个就是阻止大家的聚会可能是一个很好的一个建议很好的措施。我们可以看到相互之间比较一下我们可以比较一下对这个新冠病毒的命令卫生命令秩序的情况，大家可以做一个比较这样的话呢就可以看到这个病毒是可以被阻止的，这个病毒是可以被这个有效的这个延缓。
We lose sight of this in our discussions.
那么同时候呢，有时候可能大家一下子忽略了，那么这样的话就会导致病毒的传播。
Reinforce what the order says, and it will take a moment, but I think it's important to look at what the order says, and this has been as a definition of event under the orders, and it refers to anything which gathers people together on a one-time, regular, or irregular basis, including a gathering in vacation accommodation, a private residence, banquet hall, or other place, a party, worship service, ceremony, or celebration of any type, reception, wedding, funeral, celebration of life, musical, theatrical, or dance entertainment performance, live band performance, disc jockey performance, strip dancing, comedic act, art show, magic show, puppet show, fashion show, book signing, reading, recitation, display, movie, film, meeting, conference, lecture, talk, educational presentation, acceptance, school, post-secondary education, institution,
包括了
auction,
很多的
fundraising
教育
benefit,
的这个
contest,
讲座
competition, quiz,
这
game,
个
rally, festival,
高中
presentation,
以外的这些
demonstration,
研究机
athletic,
构的
sporting, or other physical
presentation
activity, exhibition,
还有
market or
体育
fair, including a trade fair,
包括了
agricultural
这
fair,
个
seasonal
商贸
fair,
活
or
动的
episodic
这种
indoor
展览
event that has as its primary purchase the
包括
sale
了
of
农业
merchandise or
这个展览
services,
全部停
e.g.
了
Christmas craft markets,
因为
home
这些都
shows,
是在
antique
室内
fairs,
的
and the
现
like.
在
And for certainty,
还有包
including a
括
gathering
圣诞节
preceding
的
or
这个
following another
不是
event.
圣诞节每年还有装饰的这种这个
the
小
most
的这
recent
种
version of it, because it's
marketing
been
都
amended,
没
is
有了
available under PHO order November 10th,
我们
page
现在
3.
马上都
And
在
I
修
think
改
what
修
it
订
says
这些
is
措施
that
政策
what we're trying to do here, and these are all both
所以所
religious
做
and
的就
secular
是希
events,
望能
of
够
course, of all
阻止
kinds,
这个病毒的
except with
传播
weddings and funerals and baptism, where we have a maximum of 10 people, which is itself difficult, but that is an exception from the rule. Is what we're asking people to do is to reduce social interaction in this period, that this is one of our means
所以他也是说到了这个是每个人只能自己这个做的那么这个是都是有大家都有很多热心的这个想法但是这个现在没有办法这个阻止大家的大面积的聚集就是阻止社交的减少一些社交的活动这个只能是我们从命令层面上这个也是只能是使得我们能够保留我们的价值观能够继续延缓病毒的传播大家也可以想象一下如果你现在还在我行我素大家可以想象这个些长期护理院所遭到的冲击
by following the advice and the guidance of Dr. Henry and her team. I have a couple of updates I wanted to bring up today on that we regularly provide, one with respect to PPE. As you know, since March, the following has arrived in BC, as we announced as of last Monday, November 16th, 7.5 million N95 equivalent respirators, almost 126,400,000 surgical or procedure masks, almost 2.9 million pieces of eye protection, including goggles and face shields, just over 223,600,000 pairs of gloves, and just over 14 million gowns. Over the past week, the following PPE has arrived in BC: 268,616 N95 or equivalent respirators, 4,292,350 surgical procedure masks, 5,100 pieces of eye protection, 11,780,550 pairs of gloves, and 1,023,275 gowns. As I mentioned last week, and this has not been included in these totals yet, as we're working to inspect and sort a huge arrival that came on November 12th, but that arrival includes approximately 43.2 million pairs of gloves, 105,000 gowns, 24 million procedure masks, and 21,600 procedure masks with a visor. And I want to thank everyone involved in doing that extraordinary work and also doing the work to ensure that all of this material meets the test of our public healthcare system and the requirements of the people who work in it. I want to also bring you up to date on our influenza vaccine measures, and this is good news story in the sense that based on both national and provincial surveillance that all indicators of influenza activity remain exceptionally low, as Dr. Henry reported last week for this time of the year. Despite the increased level of testing, to date there is no evidence of influenza circulating in BC communities, and no long-term care facility influenza outbreaks have been reported so far.
他说现在目前为止现在看来流感在本省没有流行起来
2,027,300 doses of flu vaccines have been distributed by the BC CDC
那么目前从 BCDC 的部署情况全省已经完成了200多万支这个流感疫苗的这个分发部署那么我再说一下周五到周六是713例周六到周日是626例周日到周一是594例还有11例是 Epic Link 也就是我们说的就是这种怎么说呢仪式的那么3天是1933例总数到了27,407例那么其中呢延安卫生局是414例新增飞沙卫生局又是一骑绝尘了1304例岛上卫生局是48例
a significant number.
内陆卫生局是新增了104例，北部卫生局3天新增了61例。那么境外获得的我们叫输入病例有2例。那么现在为止，全省 active 的 case 记录在案的是7360例，住院的是277例，其中59例是在这个59例是在这个重症监护。
The orders that we've made and the actions we're asking all of you to take.
现在这个数字真的是吓人，就像这个 Bonnie Henry 说的，现在是像铁人三项里边骑自行车一样，现在都还没看到顶，我爬，骑自行车这么累，爬这么一个坡，还都不知道看到顶在哪里。
Impact on our health, our safety, and our future. And you can see this week how clearly that is. We certainly wouldn't have asked to make the sacrifice if it didn't save lives. You can't barter with COVID-19. It doesn't, there's no litigation launched by COVID-19 as to whether it infects us at one age or another. There's no arguing with COVID-19 as to whether it deserves to enter our household or someone else's. There's only a virus that seeks to thrive based on our humanity, our need to connect, our desire to gather, our nature to share. These are all good things. All of the events I've listed, or at least just about all in the event order, are things that make our society, our life more worth living. They're the things we do together. We are social beings, and all of them, when we do more of them, tend to be an example of broader public health. It is a difficult time, but we must use the skills we've been taught. We must follow the guidance we've been given. We must fill the promise of the orders we have put in place to help keep us safe. Aujourd'hui, nous faisons le point sur le nombre de cas pour 3 périodes de référence de 24 heures chacune. Il y a eu 17 nouveaux décès liés au COVID-19.
现在这个数字真的是有点高。我看了一看，希望上个礼拜一，今天是23号，上个礼拜一应该是16号比上个礼拜一看一看上个礼拜一呢是654、659、646，那么是1959。这个礼拜一报的是713、626。594几乎没有变化虽然是1933少了26个，但不说明问题。这个在上个礼拜就是16号之前是应该是9号，9号的话呢是他们报了2天，一个是536，一个是461，这个然后是11月2号是352、389、379，现在听听300多这个数字，觉得很好了，很少了。但是没想到现在已经700多了，真的是。
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question today is from Vaughn Palmer, Vancouver Sun.
Good afternoon, Minister. Good afternoon, Dr. Henry. The Seniors Advocate, BC Care Providers Association are both saying that rapid and regular testing of staff in long-term care would be
这个是说到老年人的长期护理院有一个就是为长者的呼吁的这个团体，希望加强长期护理院职工的这个测试工作。
Why isn't it being done in long-term care here in BC?
他说：“你们冰球和电影的都这么做了，为什么长期护理院都没做？因为都是快速测试他们说的是个快速测试技术。
So the short answer is that
他说简短来讲
is not available in what they were describing.
那么就是你们描述的这种快速测试现在还不够。
look at is where this has been done in other provinces.
那么其他的省份已经做了这个
panacea. It is not what is going to solve our issue.
那么现在看下来没有解决很大的问题，因为这个很多假的测试结果
and yes, they certainly do
不准确
in some sectors for short periods of time.
因为
but the yield and the volume of testing that would require is not at the point where it would be helpful for us.
那么同时呢，在其他国家这个测试大规模的这种混合测试呢，在 BC 省也不合适那么所以呢，现在的人力有限，所以每天的测试的速度。
asymptomatic workers as well as the residents in care homes and in
所以现在从据 BC 省的这个测试的具体情况呢，现在只能是针对这个有症状的无症状的，现在还很难抓。
challenging times. We don't yet have that type of a test that we could easily every day
我们现在还没有这种每天能够简单快速的测试的这种试剂和方法，特别是用于长期护理员，让他们每天测。
And the NHL didn't have a problem, but certainly on some movie sets we've seen it in the United States in some situations too. So it's absolutely important, and we will be looking at it as we have the tools. We'll be using them as we can, but we are optimizing what we do have right now to try and prevent. And the other thing I think that's really, really important is the risk in our care homes is proportional to the risk in our communities. And we see that, and we have to be very mindful that we as healthcare workers need to watch what we are doing in the community so that we don't take on risk from some of the social interactions that we then take into work. And that's something right now we absolutely need to focus on.
Do you have a follow-up, Bon?
Yes.
这位记者我很欣赏他，每次提的问题都比较尖锐。
From what I've seen from BC Centre for Disease Control, about 2/3 of the deaths in BC from COVID-19 are long-term care residents. I keep hearing from long-term care residents who they say it's not us, it's not the visitors, it's got to be the staff. Doesn't just the rate of the spread here and the death rate lend a sense of urgency to doing more that's being done?
I can't say that there is more that is more urgent to us than doing everything we can in our long-term care homes. And I'm not sure that I know of anything more that we can do. And it is absolutely staff and people who work in care homes that are the index case in many cases. But partly that is a bit of an anomaly because we have reduced so many visitors into long-term care. And when we look at that balance of the density of how many people go in and out of a care home, that's where risk comes in, and that's where risk in the community is reflected in care homes. We have put in orders across the province to address just that, so that we can reduce the risk in our communities, and that in turn reduces the risk in our healthcare system.
希望的就是在这个长期护理院呢，减少这个风险的，减少病毒的风险。
I think just to say that the investment and the effort has been massive here, and in a comparative sense, one of the reasons, the principal reason, and it's embedded in what you said, Vaughn, that we have the lowest rates of mortality of equivalent jurisdictions. The jurisdictions 5 million or more in North America. I think there are 27 of them, and BC has by far the lowest rate of mortality in that group of jurisdictions, states, and provinces, is because of the efforts being made in long-term care, which have been massive in terms of PPE, the single site order, and all the other measures that have been in place. But also what we need now, I mean, what's very clear, and tell you nothing is being spared in this regard. And I think, I mean, we feel it every day because I don't think families in long-term care in BC really think very much about what's going on in Winnipeg or what's going on in Nova Scotia. I know our family doesn't, I know other families don't. So I appreciate that every single case, every single outbreak is of concern and of consequence and requires a massive response. And we would love it if there was a single or an easy response to that. There's not. I think the combination of measures that we put in place have been more effective than other places. But that doesn't mean the losses haven't been tremendous and that we don't feel them everyone working in the system feels them, and all the families feel them, and especially those who've lost loved ones feel them. So the effort will continue. There's not a day goes by when we don't talk about what more we could do to address the situation in long-term care. And we're going to continue to do that in every moment and every step. As Dr. Henry has said, let's talk about the use of rapid testing and so on. It's been told to me and others, and people will note this, places such as the White House use a lot of rapid testing as well. But it is not sufficient in itself, but itself and can cause
所以呢，这个我们这个 BC 省现在没有这个快速的满足你天天去测，因为长期护理院有那么多工作人员，成千上万的，那么没有这个能力。第二呢，就是说到了像中国这种大规模的，它混在一起测试，现在我们 BC 省也没有这种机器。那么现在呢，可能上礼拜我记得他说是每天测试的容量是12000多啊，不是容量，就是实际完成的测试数量是12000多，那么每天也就这个数字了啊。相对来讲，这个不是快速测试的，所以呢，数据还整一点，因为这个快速测试刚才伯尼斯说的，这个错误率比较高啊，所以要求是天天测，天天测啊。大家看到了，伊隆马斯克他测了4次，有2次是阳性，2次是阴性。
If they qualify in terms of the fact that they are done within a vehicle where someone can drive through a light show, are those events okay during this time period where the restrictions are in place?
他说，如果限制令没有取消的时候，大家是不是可以在室外可以看看人家这种圣诞灯啊，或者在车里边看啊？特别是温哥华不是有一个 Bernard 的这个Garden 吗？那么现在来讲，这个2个礼拜的命令是到12月7号啊。那么现在是没有室内室外的区别，任何事情都停止了啊。这个大家看到了，都要取消，都必须取消。那么我们要看到，只要是任何东西可控制了，我们慢慢再放。现在我们必须停止所有的集会，所有的活动，只要是人员聚集的，全部停止。那么现在从目前来看，全部停止。
I do. One of the things that was raised over the weekend from spiritual leaders, faith leaders, was, why are their gatherings canceled while bars and restaurants remain open? So what is your answer to that?
教会啊，这种聚集性的都停止，为什么餐厅不停止？那么还有就是，他也是说到了这个影剧院，只要是符合命令的都能停，都不停。那么教会为什么要停
？Yeah, so I can't say where that came. It was quite clear in my mind where the events issue was. So we clarified it today that movie theaters do fit into that. And it's the intent of the order that we reduce those opportunities for social interaction. And events at bars and restaurants, I know they were having like live music events, other things. Those are also suspended for now. The other thing we do know about restaurants is they feed people, and there's many important ways that they are part of making sure that people can get a meal. So that is one of the reasons why restaurants are not events. They also have very detailed COVID safety plans, and we know when those plans are followed, and that the risk is low, and that includes no more than 6 people to a table, no table hopping, wearing of masks, and supported that with the order that will be coming around where people need to wear masks in indoor public spaces. So it is an important part of many communities being able to, and many people being able to
所以他说餐厅是不能停了。这个问得好，宗教的要停了，餐厅不能停。有些影院在符合卫生条例的也可以不停。他们这些。他说我们也可以跟宗教领袖他们都有一些交谈那么上个礼拜三我们颁布了严格的命令我们也是提前24小时通知他们哪些该做哪些不能做
with His Excellency Archbishop Miller today who someone I hold in very high regard, and an opportunity to talk about these issues and why it's important. There is a tendency to say, look over there, to see these as like a speed limit, and it says 80 and maybe I can go 86. That's not what these are. These are efforts. These are provincial health orders to help stop the spread of a virus that is harming our loved ones in long-term care and causing great disruption in our society. And these are the things we're doing together to stop that. And right now, in these 2 weeks until December 7th, events aren't possible. And I know people sometimes want to look and compare this and that. I would just say this is a time, of course, when we need spiritual support as much as anything else, and this is true regardless of religion. This Sunday is the first Sunday in Advent, and ordinarily I know where I'd be that day, and it's a significant loss, particularly right now, particularly in our congregation and in lots of congregations around the province. So I know that there is loss, but the effort to get the message out virtually and to have virtual services is really important, because it helps us stop the spread of COVID-19. It's not because people haven't done the right thing in the past. They have. There's been extraordinary efforts by faith leaders, by businesses, by everyone to follow guidelines with respect to events, the maximum of 50 people at events. But right now we just can't have them in this period. We need to stop the spread. That's the advice of public health. These aren't punishments, they're tools all of us can use to help one another deal with COVID-19.
Binder Sajan, CTV. Binder, are you there?
Christmas events with lights. Yes. Hello?
Go ahead.
Hello. Can you hear me? Yeah. I'm just following up on what Richard was asking there with regards to the events. How much notice would you be able to give these events, if case numbers do go down and they are able to open up? Obviously, December 8th is just a couple of weeks before Christmas, so wondering how quickly that could happen.
那么因为他说12月8号离开这个圣诞节很近了，你们有什么评判依据啊？数字下来了，数字上去了，你们才决定这个哪些活动能开，哪些活动不能开啊？他说我们每天月俱日的在看我们的情况到底是怎么样，我们这个措施如何调整我们的面临的困难在哪里这个传播的地方主要是在哪里？有可能我们要延长这个禁令我们只是希望做正确的事情
We're not trying to get rid of this virus. We've come to the realization that it's not possible to get it back into nature, to have zero cases in our setting because of the movement of people, because of where we're situated geographically, and because of the climate and the conditions that we're in right now. So things that we were able to do in the summer, and perfectly, we had a buffer, I guess, in many ways, because we had got our rates down low enough. We had the weather on our side. We can't get away with those anymore. So we need to take a step back from all of those places where we come together, no matter where it is. And we will see if that is going to make the difference over the next coming weeks. We will never be able to get rid of all of these restrictions until we get to the point when we're into that marathon and we have vaccine available. But we can look to a future in weeks and months where we can have more interaction if we're able to break that cycle right now. I think of what Pericles said to the Athenians in, I think it was 230 BC when they were dealing with the plague. We need to put aside our private sorrows and concentrate on securing our common safety. And that is where we are right now.
不好意思啊，这个可能我尽量少说一点，我把重点说一下。
I just want to ask for a little bit of clarity around who you can go to a restaurant, bar, or pub with. You've said when these establishments follow the guidelines, there is a low risk of transmission. So are people able to socialize with those outside their household bubble?
For this 2 weeks, we're saying stick with your household bubble. And for some people, that may mean 1 or 2 people who they have close contact with their pandemic bubble.
Next question is from Brent Richter, North Shore News.
Hi there, Dr. Henry. I'm wondering if there's any more detail that we can learn about how the virus is continuing to get into the care homes and hospitals given all of the restrictions in place.
Yeah.
这位先生想问的是这个病毒是如何传播，能不能详细一点啊？长期互联怎么传的
？But very often it's when somebody doesn't recognize that they're ill, or in that period of time prior to showing symptoms.
主要是在这个潜伏期里边，很多人没有意识到自己有病毒，把这个病毒传给人家了。
But as we get more
这个大学没有，基本上没有什么大的区别，每个人个体。
Who works in healthcare, and there's a lot of us, has the virus and may be infectious to others goes up. So it becomes more and more important that we use all of those layers of protection.
所以他说现在是越来越重要的，就是要把所有的卫生措施都用上去，不能依靠一种卫生措施。那么我们现在的主要是这个对我们来讲困难来讲，就是如何最早能够找出这个受感染的人。
That period of time just before, where people are sometimes most infectious just before they start to show symptoms, is also the period of time where the tests work least well. So we're in a bit of a conundrum right now.
这个里边是真的也是有，就是第一个测试，你测试了就是有时候不是阳性的，但是它过了2天，它是真的会发展成阳性。
所以这个他也是说的。Hoping that we can get some easier tests. People don't like having a nasopharyngeal swab every day, and that can be very challenging for people.
所以他也不希望用一种这种快速测试的这种方法，因为这个不是很准。
Meticulous attention to our own risk, how we're feeling every day, but also the risk around us. So if anybody in our family has been exposed or has illness, we need to make sure that we're paying attention to that as well. And that can be a challenge in healthcare because we tend to be presenteeism. We go to work no matter what because people are depending on us. So we have that balance. Sometimes it's residents, sometimes it's staff. Most often right now staff because residents aren't moving around as much. But it's a challenging situation for us, for sure.
Brent, do you have a follow-up?
Do we have documented cases of people showing up who are symptomatic and we only find out about it after it's too late?
他说了，这个如果有时候发觉自己得到阳性的报告，其实已经晚了。他说是的，的确是这样困难。有些人根本没有意识到这个。
Their symptoms start.
有些人呢获得的时候，这只有24小时以后才有症状。
To universal mask wearing in our
所以希望这个呢，就是大家有一个能够自我隔离，或者是戴这个口罩。
Transmission in communities. That's where mask wearing becomes more important.
所以现在口罩是越来越重要，因为社区里边多了，本来社区里边不多，所以口罩还不是，特别是夏天的时候那么现在呢，社区的感染率越来越高了，所以口罩就很重要。那么社区里边戴口罩，他说的社区戴口罩就是本地的医院啊、零售店啊、指甲店啊、美容院啊，这个很重要了。
In the list of prohibited gatherings, Minister Dix mentioned art exhibitions. Does that mean that art galleries need to close, or is this specifically for openings? Can you please clarify that?
Would be events at galleries? Yes.
所有的团聚都要停是的，因为这个记者问的是展览会啊，是不是有一些可以开，有些不可以开，都不可以开。
Some more definitions about what that means, but yes, that's what it would be.
所有的都要关。
Yeah, I don't really understand what that means. I mean, art galleries have exhibitions on as their primary content. That's what people go to art galleries to see. So is an art exhibition considered a gathering?
Okay, so when you have, they have the opening when they put the paintings up, the opening is an event. The day-to-day with small numbers of people going through is like a retail shop. So there needs to be COVID safety plans in place for that, for the day-to-day operation. Does that make sense?
我也没理解。
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. Thanks again for taking our questions. My question today is regarding, again, if you could explain the evidence-based rationale behind not making masks mandatory in schools, because we're hearing
他还是要解释一下为什么学校里边不是强制戴口罩。
to wear masks as often as possible in schools in any situation. So,
因为他说我也知道有些孩子就是不愿意戴口罩，或者是带来这个风险。为什么学校就不强制戴口罩？
Schools are not public spaces
他说因为学校不是公共的开放区域因为大家都是知根知底。
What schools have are individual COVID safety plans that meet certain criteria. So you're with the same people every day. You don't have people walking in and out. So masks are an important part of some areas of schools, in particular when you're in common areas, when you're with mixing, passing by people in other cohorts, etc. And absolutely, I think that you should encourage mask use, particularly for the adults in the schools setting, and that is something that we've been working with them on for quite some time. And we know that that teachers have been involved in all of the COVID safety plans in a school. So it's similar to other workplaces where you have plans in place for how you manage within your workspace, not the public areas of the building, for example. So there are COVID safety plans that do include mask wearing in the schools.
那么我们这个学校里边是应对措施里边是有戴口罩这一项的。
Regarding if Minister Dix could explain again the influenza situation where
那么他也请卫生厅长说一下流感疫苗的情况。
How do we know that the flu isn't as prevalent this year as it has been in past years, and what do we owe that to?
Yes, control.
因为刚才说了，我们今年的流感感染率很低。
The BCCDC website,
大家可以到我们的 BCCDC 的公告栏里边去看。我们每天也是对这个流感有监控的数据。
Way back in January and February,
我们6月份、1月份、2月份的时候已经知道这个情况比较复杂，所以我们已经在那边应急了，定这个流感疫苗。
to physicians' offices because there's a lot of virtual care. So one aspect of our influenza surveillance is what we call sentinel physician surveillance, and we're now using the COVID testing sites. So a certain proportion of the tests that are done at the COVID testing sites are also tested for influenza as a way of doing surveillance across the province. We also have anybody who's in a physician's office with an influenza-like illnesses who gets tested. We follow those swabs, and we look at the emergency department data around people coming in with influenza-like illness. So there's a whole different categories of types of surveillance that we pull together, and once a week there's a surveillance report, and all of the influenza viruses across the province and across the country are typed, and we report some of that to the Public Health Agency of Canada, and in turn to the World Health Organization. There is a global influenza surveillance network that our BCCDC Public Health Lab is part of as well. So there are many different things we look at, and generally this time of year we start to see influenza increasing. We've seen maybe about 700 to 800 positive influenza tests at our lab by now. And I think last week we saw, up until last week, we saw somewhere around 7. So we are quite confident that we are looking for it, and we're not seeing a lot of influenza circulating right now. We think and we hope that this will continue, and it's partly because of the measures that we have in place to prevent transmission of COVID-19, because it is transmitted in very similar ways through droplets that we inhale from somebody who's been sick. So the fact that everybody's going out and getting immunized is very helpful as well. And we saw this in the southern hemisphere.
免疫的话是很重要的，这个是很有帮助的。因为现在南半球现在又是热了，所以他们。
And so we are monitoring anybody who has symptoms in long-term care gets
那么我们也是对长期护理院的流感症状也是做了很仔细的跟踪监控。
And we've been using that as well to help us understand how COVID has been transmitted over the past number of months as well.
因为我们他也是说到了，我们所有的数据呢，也会给南半球带来受益啊。因为南半球现在是夏天，马上也要到冬天的话呢，我们的这些防疫防控的这个措施数据啊，给南半球的国家会带来效果，带来这个经验教训。
regional restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Zara Premji, CBC.
Hi, Dr. Henry. Can you please provide some clarity about the rules around traveling for sports? So some teams are made up of players who live in different but nearby health regions, like a team made up of players from Vancouver and Burnaby, for example. So can those players continue to practice and play together while still respecting the intent of your public health order banning COVID-related sports?
Yes, and these clarifications will come, but yes, the intent is that teams won't be traveling to play teams in other regions, and that we won't have tournaments or for other sports and tournaments are coming together for sports-related competitions that make people travel between regions. But yes, if I live in Burnaby and go to school in Vancouver and my soccer team's in Vancouver, then that's fine. What we're talking about is the movement of teams to play in different areas. And I will say that, we put in some very basic guidance. Initially, we had, in the region of Fraser Health and Vancouver Coastal, we had restricted indoor team play until we had a better sense of what were the issues and where were things breaking down in terms of people getting together and transmitting the virus. And so last week we modified it so that we could stay at a version of the Via Sport Phase 3 opening, and with the restrictions for all of the sports, no spectators and no team travel for games. What we are doing though is having ongoing conversations with Via Sport because it's really become clear that we need someplace in between. These staged reopenings were developed as we were heading into the summer and updated in August when we started to move to what we called Phase 3. And it's really recognizing that there's probably a gradation in there. We need somewhere in between the 2 and 3 that allows for some team play between teams in the local area, but also recognizes that for some teams and some venues that it's not possible to have team play without the particularly young people getting together on the bench or the way that things are structured. It makes it much more challenging and more likely that people are going to come together and maybe have opportunities to spread the virus. So we are working with Via Sport to come out with some guidance that is relevant to where we are right now in the pandemic, and recognizing that for many teams that might mean, I know some of the local hockey leagues are looking at doing drills and instead of having games right now, and I think that's perfectly appropriate, especially for this period of time, and then we can look at how we go. The intent that we had was to make sure that we still had opportunities for people to participate in sports. We saw that in physical activity. We saw that early on in the pandemic when everything was stopped, that it really had a detrimental effect, particularly on young people. So we want to get those opportunities to continue, so the ways that they can be done the most safely for your team and your community is what we're asking people to do right now.
I do, thank you. So, Dr. Henry, I know you've also said that BC is not signing on to this COVID alert app right now because you don't think it will make a big impact, but what do you say to those who want it regardless and are basically frustrated that BC is preventing them from accessing a service by the federal government. And if we can get an answer about the COVID alert app.
那么这也是说到了有一款 app 为什么 BC 没有签署就是参加这个 app 的
What we're not doing is as public health having codes because right now it's leading to more we have concerns about the potential for increasing work without benefit. We are continuing to talk with the federal government about their app and the changes that we would like to see. We're also talking with Alberta and Yukon about modifying the Alberta app to make it more aligned with what we would like to see. So it is another tool.
因为现在我们还有其他的像阿省啊，他们有一些
the
其他
advice
的
that
工
we
具。
got from people on the ground here in BC is that they didn't feel it was a tool that would be helpful for us
他们
right
有些
now.
人不认为这个 app 是带来有实质性的帮助没有什么太大的帮助因为有其他的省在用。我也觉得这个 app 有什么用根本有屁用，没有用。那么这个最后一个问题呢，是 CDC 记者是希望他们用法语回答。那么我再把过去3天的数字再给大家简述一下。周五到周六新增了713，周六到周日新增了626，周六到周日到周一是新增了594这个 AppLink 就是疑似的，就是有11例，一共是1933例，总数到了27407例，其中沿岸卫生局3天里边新增了414例，飞沙卫生局新增了1304例，北部岛上卫生局新增了3天新增了48例，北部卫生局新增了61例，那么内陆卫生局新增了104例，境外输入2例，也就是说 BC 省外的是输入有2例。现在目前为止记录在案的活跃的案子是7360例，其中住院的是277例，重症监护的是59例，一共呢是全省现在有10200个人在我们的公卫系统的工作人员的监护下在自我隔离。那么过去的3天很遗憾，这个死亡17例，现在全省总数是348例。这个是很遗憾。那么他说今天就到此结束，礼拜4再大家好吧。那么我今天也说完了，他说是 Wednesday 应该 Thursday 要不我听错了。好了，各位观众，今天的给大家转播的 BC 省新冠疫情就到这儿，感谢大家的收看，我们下期